Hey, this video will be an introduction to Tourette syndrome, which is something that, I think a lot of people think they have an idea of what it is. We're going to go over the true diagnosis, the true definition, how to diagnose, that sort of thing, and also the treatment, which is an important part of this. It's really been stereotyped by the media and by, mainstream society, but in reality, what you think, what has been stereotyped of these people who scream obscenities, that's not in reality very accurate to what true Tourette syndrome is. A lot of people try and use this to, not necessarily as a cop-out, but as an excuse. And true Tourette syndrome, individuals who are affected by true Tourette syndrome would rarely be in an instance where they're using it as an excuse. And you'll see why. What actually is going on in Tourette syndrome is there's a disorder in the basal ganglia in the brain, which you can look that up, Google search a good image of that. But there's a disorder there. That's really the best that we know right now, what the mechanism is going on here. We've detected that these patients have an anomaly there in the basal ganglia, as opposed to an unaffected patient. And that's an important thing to know for boards there, for testing purposes. But what is Tourette syndrome? Well, it's this disorder that's characterized by the sudden, rapid, recurrent, non-rhythmic, so it's not like quarter notes, it's random, stereotyped tics. They can be vocal or motor tics. So like motor tics would be like the shaking of the head or blinking of the eyes, twitching of the mouth, that sort of thing. And then the vocal tics can be everything from grunting or coughing or just clearing the throat. You hear a lot about children who have this propensity to clear their throat randomly, that sort of thing. The big thing though, what sets this apart, a true diagnosis of Tourette syndrome from just a kid who's in a phase where they're clearing their throat every 3 seconds out of habit, is that these symptoms, these tics have to be going on for at least 1 year. So if you're watching this and your kid keeps clearing his throat and it's only been going on for a week and they forget about it the next week, or it's not funny to do it at school anymore, then that's not Tourette syndrome. That's not necessarily a tic you got to worry about or go get treatment for. We're looking for these tics for greater than 1 year. And when I say that word tic, it's T-I-C, and that means these repetitive, non-rhythmic movements, where they be motor like muscle movements of the head or the hand, or they be vocal tics, like the grunting or the saying of words, that sort of thing. Now there is a certain phenomenon that the media has really grasped onto, and that's called coprolalia. And what that means is it's the involuntary obscene speech. So that's where you see the people just yelling, swear words non-rhythmically at random times. And in truth, only 10 to 20% of Tourette syndrome affected individuals actually experience coprolalia. I'm going to write that word up here so everyone's on the same page. Coprolalia. That's what I'm talking about there when the people are screaming bad words, screaming different things. Only 10 to 20% are affected by that. The rest are just usually these, I'm going to use the word harmless tics, grunting or clearing of the throat or shaking of the head, that sort of thing. Another big part of the diagnostic criteria here is not only do you have to have these tics for greater than 1 year, you also have to be diagnosed by age 18. So if you're with an adult and all of a sudden they start screaming obscenities and say, oh, I have Tourette's, I just got it last month, or that sort of thing, wrong for 2 reasons. One, they're already above 18, so they can't be diagnosed with it. And two, it's only been going on for a month, not over a year. So make sure that the diagnosis occurs, those tics have started before age 18, and they've gone on for a year. And then lastly, Tourette syndrome is positively correlated with OCD, or obsessive compulsive disorder, and or ADHD, attention deficit hyperactivity disorder. There's just something about these mental disorders, these psychiatric disorders, that they're linked together. We're not exactly sure what that mechanism is yet, though. And then lastly, the treatment for these are going to be your run-of-the-mill antipsychotics like haloperidol, pimozide, that sort of thing. And then behavioral therapy is also very beneficial for these people if they're made aware of their tics and they learn how to control them. You know, it's kind of some second line things like benzodiazepines or alpha-2 agonists like clonidine. Those can get the patient to chill out a little bit. Obviously, a benzodiazepine is going to get them to relax. It's like a sedative, and that would help with some of these hyperactive tics. That's an introduction to Tourette syndrome. Thanks for watching.